In this video, for measurement of motion of hip flexion, that the normal body around 120 degree, the patient is lying supine. Palpate the greater tool hunter to make easy to palpate. Do the internal and external rotate of the hip. Put the axis of the goniometer on the greater toe hunter, the stationary arm parallel to the bed, the moving arm on the midline of the femur, and ask the patient to flex the hip without bending his back. For passive range of motion, maximally flex the hip held by the examiner. For the grade 3 is where the patient complete the test range of motion and again gravity without the resistance. Grade 4 is hip flexion hot against strong to moderate resistance. Grade 5 is normal. Patient tolerate maximal resistance. Grade 2 eliminate the gravity. Patient position is lying side and support by examiner the trunk in neutral alignment. The examiner standing behind the patient cradle the test limb in one arm with hand support under the knee. Opposite hand maintain the trunk alignment at the hip. The patient flex support hip knee is permitted to flex to prevent hamstring tension. Instruction to patient bring the knee up toward the chest. Grade 2 is poor. Patient complete the range of motion without again gravity. Grade 1 is stress, palpable contraction but reversible movement. Grade 0, no palpable contraction of muscle.
For the patient position is the lying prone position. The axis in the greater throat hunter, the stationary arm following to the bed, and then for the moving arm in the midline of the femur. For the active one, ask to the patient to move the hip joint with himself without the assist with the examiner. And then for the passive one, ask to the patient to move with the full range of motion but with the assist of the examiner. To check the muscle strength, we start from the grade 3. The grade 3 is patient can move against gravity without the resistance. For the grade 4 is the patient can move against gravity with the small resistance. And then for the grade 5 is patient is normal, can move with against gravity and the maximal resistance. For the grade 1 is flicker or trace contraction of the patient. And then for the grade 0 is no contraction. For the grade 2, the patient position is the lying side. Put one hand under the knee to support and give space to move during the test. The grade 2 is poor. The patient can just move without the gravity and without the resistance. For the patient position is the lying supine position. And then for the axis in the anterior superior iliac spine. And then the stationary arm is parallel to the each axis. For the active is ask to the patient to move away from the midline of the body with the himself. And then for the passive one, we can assist the patient to move the hip joint away from the midline. Next, to check the muscle strength, we start from the grade 3. The patient position is lying side position. Grade 3. The patient can active movement without the resistance against gravity. Grade 4. The patient can active movement with the small resistance against gravity. Grade 5. Patient can active movement with maximal resistance and against gravity. The next is grade 2. The patient position is lying supine position. The grade 2 is the patient can achieve the active movement but without the gravity and the resistance. The grade 1. The grade 1 is the flicker or trace of the contraction. Grade 0. The patient is not contraction of the muscle.
In this video for measurement range of motion of hip adduction, that the normal body around 20 degree until 30 degree. The patient is lying supine. The opposite leg test is away from midline to prevent disruption. Put the axis of the goniometer on the anterior superior iliac spine. The stationary arm is parallel to each axis. The moving arm is midline of the femur. Continue establishing the pelvis. Get the leg across the midline of the body and over the opposite extremity. Measure the range of motion of hip adduction and passive range of motion maximally adduct helped by the examiner. In this video for test muscle strength of hip adduction, the patient position is lying side, the non-test limb in 25-degree abduction. The test patient adduct hip until the lower limb contact the upper one. Grade 3 is fair, complete full movement, hold and position but take no resistance. Grade 4 is good, complete full movement but tolerate strong to moderate resistance. Grade 5 is normal, complete full range of motion, hold and position against maximal resistance. Grade 2 eliminate the gravity. The patient position is supine. The examiner standing at side of the test limb. The non-test limb is some adduction position to prevent flexion as the limb moves across. The test adduct hip without the rotation. Grade 2 is poor. Patient adduct limb through full range of motion. Grade 1 trace, palpable contraction, no limb movement. Grade 0, no palpable contraction. In this video for measurement range of motion of hip internal rotation, that the normal body 35 degree, the patient is sitting on the bed and freely hanging off the leg. Put the axis of the goniometer on the mid of the patella. The stationary arm is perpendicular to the line of progression. The moving arm is on the mid of the tibia. Measure the internal rotation of the hip and the passive range of motion maximally rotate internally helped by the examiner. In this video for test muscle strength of hip internal rotation, the patient position is sitting and freely hanging off the leg. The arm are used for the trunk support at the side. One hand grab on the distal side just above the knee. Grade 3 is poor, hold and position but take no resistance. Grade 4, hold and position against strong to moderate resistance. Grade 5 is normal, hold and position against maximal resistance. Grade 2 is eliminate the gravity. The patient position is lying supine. The test leg is in partial external rotation. The test patient is internal rotate hip through available range. Grade 2 is complete range of motion without against gravity. Grade 1 palpable contraction activity in either or both muscle. Grade 0 no palpable contraction activity.
Hip external rotation assessment. The axis in the mid of the patella, the stationary arm, is perpendicular to the line of progression. For the moving arm is in the midline of the tibia. And then for the active one is ask to the patient to rotate the hip in the externally. And then for the passive, we can assist the patient to hold maximum range of motion. Next, to check the muscle strength, the patient position is a sitting position. We start from the grade 3. Grade 3. The patient can achieve the active movement against gravity without the resistance. The grade 4. The patient can active movement against gravity and the small resistance. Grade 5. The patient can achieve the active movement with the big resistance and against gravity. Grade 2. The patient can achieve the active movement, but without the gravity and the resistance. The grade 1. The grade 1 is the flicker or trace of the contraction. Grade 0, no movement and no contraction.